From allergies to zinc deficiencies, hangry to hay fever, we provide easy-to-absorb information to improve your health. It sounds like health on Texas A&M Health Talk. Howdy, welcome to Sounds Like Health. I'm Mary Lee Meyer, and I am here with Angela Clendenin with the School of Public Health and Martin Mufich with the College of Nursing. They are both faculty advisors for the Student Steering Committee for Disaster Day. The Health Science Center held its 11th annual Disaster Day last Friday, so we wanted to bring them in to tell you guys a little bit more about that and maybe discuss some disaster preparedness tips that you can do to get yourself and those you love ready in case of a disaster. Welcome to the show, guys. Can you tell us a little bit more about Disaster Day?
Disaster Day is an interprofessional education opportunity among all of the colleges within the Health Science Center and also including College of Veterinary Medicine and Biomedical Sciences. And it is the nation's largest student-led disaster training exercise for interprofessional education. And it involves about 500 or more students, nurses, future pharmacists, future doctors, public health practitioners, and future veterinarians all working together to respond to a simulated disaster.
That sounds like a pretty big event. What is, just very briefly, what is interprofessional education? What does that mean?
So studies have found out that when disciplines work together and learn together, that health outcomes and patient outcomes improves. So there's been a big push for IPE, interprofessional education, to occur here at the Health Science Center and throughout all the colleges. They're finding common ground. It used to be that professions were somewhat siloed and that they did their own thing and just reacted with the other disciplines when they needed to in the workplace. So by getting out and having a somewhat very unique experience for these students outside of the classroom, reacting to something that many of them have never been around, it puts them on a level ground, has to get them to work together and build that teamwork and cooperation and respect for each other.
Yeah, so that sounds pretty important in an emergency simulation. And, you can never be truly prepared for it, but this sounds like a pretty good training opportunity for them. What does the everyday person need to know about preparing for a disaster?
So most communities will use what's called an all hazards approach to their community planning for preparedness, but it also applies at that personal level. So they're just, you need to have a plan of what would happen if you could not stay in your home for whatever reason, wildfire or a tornado or a flood or a hurricane, and you need to have some basic essentials that you can just grab quickly and leave. And have a plan of where you're going and notifying your family. And so there's a lot of good websites you can go to, the Red Cross, preparetexas.gov. Those all have lists of things that you might want to think through and have either in some sort of a container or a bag that we would call a go bag or a go box that can easily be grabbed and taken with you.
So what kind of things should go in one of those go bags? What should we try and get in advance?
Well, needless to say, there's things like water is a big thing, clothes, a lot of copies of paperwork, because if something happens and your house gets blown away or the community kind of suffers a tornado, just having that information, whether it's insurance, driver's license, medications, lists of medication, lists of contacts, those types of things. Just getting people prepared to think about it. It's that saying, plan for the worst, hope for the best, but have it ready. And one item that you can buy this stuff. They have this stuff already made, but you'll find it less expensive. You put it together, but you have to remember to almost put it on your calendar to check your supplies, however that is, whatever it's going to run out on. Whether that's yearly, to be sure everything's still good and in good shape. It's kind of like if you were to, what we try to do at our house is that when you put on your calendar, time to change the air filters, time to change the batteries in the smoke alarms, probably about once every 6 months, check this box to be sure we're all good and everything's still ready to go.
And I know a lot of people wonder, well, how much water do we need and how much of this do we need? The recommendation typically is at least 3 days to 5 days worth of kind of grab and go, shelf stable food and water. And you want to make sure that you have the same for your pets and be prepared to evacuate with your pets. Have a plan of where you can take them, know if you're going to a shelter or a hotel that it's pet friendly, and have about the same amount of food and medication for them. A lot of pharmacies will allow you to go in and fill above and beyond your prescription if it's an emergency. So you need to follow up on that and make sure that that's the case so that you have enough medication with you and you're not left out.
Just that proactive ability gives somebody quite a bit of confidence, right? And there's just so much good information out there with the videos and the stuff from the governmental agencies. The point I was going to bring up is that, if it's going to be maybe a sustained absence, relatives where you could stay, and just it's kind of a morose dinner topic, but when you're, I'm not going to say like a Thanksgiving or something, like, hey, let's pretend like a tornado runs through your place up in Oklahoma. Would you guys want to come down here? Let's pretend the hurricane comes up through the Gulf. Let's pretend and have those discussions early and try to figure out how you want to do things.
Yeah, I grew up in Houston, and we had my dad's mother lived around the corner, and she was in a wheelchair, had oxygen, and so when we were kind of thinking through those things, we thought about kind of close family that we would have needed to help, assist. So that kind of got me thinking when you said to prepare for your pets, prepare for those you love that might need a little bit extra help.
Exactly. And, that brings up a really good point with your grandmother that's on oxygen, that some people are on machines that require electricity, and there's no guarantee, even if you can come back to your house in 3 or 4 days, that you're going to have electricity for a few weeks. And so I think that was kind of a surprise with Harvey. When people evacuated, they thought after it had passed through, they'd be able to come back in, and they were without electricity for quite some time. So having a backup to your communication plan, cell phones may not be working, so you want to find some other mechanism, some other access point to be able to reach out to people, as well as you can't guarantee that ATMs are working, so you want to be able to withdraw some cash in advance so that you have that just to get you by, and understanding that 3 or 4 days of supplies get you where you're going. And you'll need to be able to sustain yourself for probably maybe up to a week or two, depending on the type of disaster, before electricity is restored.
And Martin, you're a nurse, so what
Correct.
should people have in their first aid kit? What do you think? Should they bring their entire medicine cabinet with them, or do you think there are specific things that they should be sure to include?
There's the basics, of course, the antibacterial salves and the bandages and just things in your typical first aid kit. But one thing we're really trying hard in the College of Nursing is to prepare our students to take care of people in a non-traditional environment. So you roll up on a 4 or 5 car pile up and you have to make decisions. You have to keep yourself safe, almost that first responder type of thinking. But going back to your question, what do you need as a basis? Once again, I will always defer particularly to what your family needs. Is it an asthma inhaler, things like that. But then just the typical basics would be pretty good. The know your local community resources, your Red Cross, where to go. Maybe it's a church that you would go to in the event that maybe it's a smaller area that got hit. Where would you go locally? And then also know that as these terrible events occur, there's always lessons learned, right? And so there are, Angela might have to help me out on the compacts, or there's agreements between communities. So I believe that in the event that a hurricane hit the Beaumont area, the College Station has an agreement to take up to 5,000 of their people. So you are allowed to go to certain places. Those things are in the works right now, where to go.
That's a really good point. So, for example, with Houston, after Ike, people were stuck for hours and hours and hours on the exit routes. And so the lesson learned from that was they need to do what's called zoned evacuation. And so where you live determines whether you are going to get the first evacuation notice, the second evacuation notice, or be in the third wave. And you're also kind of directed to exit one way. I always try to explain to people, you may have relatives in San Antonio, but where you live, you have to evacuate towards Dallas before you can get over and then come back down to San Antonio. It's meant to try and ease that flow of traffic. So knowing that plan, being engaged in your community so you're aware of that. Texas has a wonderful resource called 211. It's a phone number that you can dial from anywhere, and it has a menu, a button-guided menu where you can access information like the different kinds of shelters that are open, in what communities, are they special needs shelters, can they accommodate pets, how many people, are they full, so it can help make those decisions as you're moving down the road.
So you recommend people know what these resources before they need them. You know, they might not have cell phone service, they might not have internet access, radio. You don't know what you're going to have, and so it's all in that preparedness.
Exactly. And that's one of, I think, the challenges in disaster communication or risk communication. It's that balance of constantly making sure people are aware of the resources that they have and to have a plan. But at some point, when is it so much that they just kind of block it out and forget about it? So it's always good to have sort of a constant periodic reminder of what you need to do to be prepared for your family and your pets.
I know I like to follow the regional, whatever city I live in, I follow the regional emergency management Facebook or Twitter. I know here at Texas A&M we have a specific emergency management social media account that gives updates and regional advice. So that's something that's helped me through my 26 years.
Well, and almost every county is going to have some sort of a website at minimum or some sort of social media presence that you can subscribe to. So I highly recommend finding those and subscribing or linking into it or liking it on Facebook. And that way it really does help you stay informed.
One other thing, coming back to the students and kind of almost this disaster day and offshoot that we hope to do is that we get students, maybe I know students in our college in community health, going out to whether it's fairs or HEBs and setting up, like you go and get your glucose and blood pressure checked, having these types of pamphlets and information so that people that are out there are walking by and they go, what's this? And the students can help teach and give them resources they might not have been aware of.
So all this is very specific to the individual. You need to know what your family needs. You need to know what your house needs. You need to know regionally what could impact you. How should people go about learning what the potential threats are?
I think probably the best way for people to understand the threats that their particular region are facing is to, again, be connected to your community, be involved with your community. Every county has to have an emergency management plan that follows FEMA guidelines or the Federal Emergency Management Agency guidelines. And as part of that planning process, they do what's called a Threat and Hazards Identification Risk Assessment, or a THERA, where they sit there and they talk through not only what are the risks and threats, everything from maybe a nuclear meltdown at South Texas Nuclear all the way down to school shootings and people walking through crosswalks texting with a large student population. And so then they assign a probability. They give it context. It's a high probability and a high consequence, or a low probability and a high consequence, and try to prioritize that planning. But all of those plans typically are public record. But the best way to understand what they say, because those documents are quite large, is to get involved in your community. Many communities have what we call a Community Emergency Response Team, or a CERT, and they go through some of the same training as first responders, and they are the first volunteers called in to help with shelter operations or volunteer registration when people descend on a community to help support a response effort. And so that's an excellent way for people to get involved.
Okay, and before we wrap up, I think we need to touch back on the pets. We are located in Bryan. We have a lot of small animals and we have a lot of large animals. What should people be kind of thinking in advance about preparations for these animals? Okay,
so number one is people need to be as prepared for their pets and have a plan for how they're going to evacuate with them. It's very similar, matches their own personal preparedness plan. Same amount of food and water. They may need blankets, crates, toys, things like that. Animals get stressed during disaster. And sometimes when that happens, your pets can actually what I just say, acquire superhuman capabilities, and they can dig out, or they can jump over fences, or they can escape out the door faster than you've ever seen them run. So probably the most important thing you can do to be prepared with your pets is to microchip them. When we deploy, that's the number one way that we can reunite people with their pets. When they're found and they come back, that microchip is unmistakable as to ownership. Having a picture of you with your pets, veterinary records, so that when you may have to go back to a shelter to pick up a pet that's been separated from you, being able to prove ownership is really key. And I know that living in predominantly rural areas, you have a lot of livestock. So engaging with your county extension agent and saying, I have a trailer, I can pull out this many cattle or this many horses or this many goats or whatever livestock you particularly have, knowing where the livestock shelter is set up, they can start to identify extra resources they may need. You know, we need to use the FFA trailers from 5 different counties to come in and help get animals out, and making sure that there's hay and the types of feed that they need and the type of care that large animals need to have is provided at that shelter. So it's really important that they know how much feed, how much space, things like that are going to be required. In Brazoria County, they set up at the fairgrounds because it's uniquely set up to house large numbers of large animals. And so being able to know where to take them, who has capacity, who can help, who needs help, all that tends to run through the Texas Animal Health Commission and your local county extension agent.
That's pretty good info. Even before we mentioned, when you identify potential shelters, if you have pets, you need to identify what shelters can take pets. Do they ever need proof of, rabies vaccine, or do you need any credentials to get your small pet into these shelters?
Rabies vaccination is required by law. Okay, but not everybody who has a pet that's running loose or that needs a shelter has that. So typically, if you can't prove that they have a rabies vaccination, they're going to get it. They'll also get vaccinated against some things like kennel cough and those types of transmissible diseases that tend to happen when you have a bunch of animals in close proximity.
So they won't deny your pet?
No, they won't deny your pet, but they're going to ask for records or proof of vaccination. And then if they don't have it, your pet may be in quarantine for a little bit or isolated away from the main population of animals in the shelter. And then at that same time, they're probably going to administer the vaccines that they need to be in a large population.
Okay, that's good to know. I know I have a few pets that I would need to take with me in case of a scenario like that. What do we do with the members of our family that might need a little bit more assistance? What about small children? Do they need any specific helpful toy or certain kind of medication? What about my grandmother who has oxygen? Can we get extra tanks in advance?
So kind of to address that, the Red Cross has got this great program called the Pillowcase Project. It's underwritten by a big company, and basically the kids are taught, in the case of a fire or you need to take something and evacuate your house, here's your pillowcase, and they practice what they need to put in. So that's one way to do that, and to practice with these with the kiddos. That helps to sway it. When we talked about evacuating to certain regions, people with certain health needs, if you think about people in hospitals that require certain things, they will also be sent to certain regions as well. So somebody that is more ill, there are very possibly designated areas where they would go.
To piggyback off what Martin was saying, that's the key. We have a lot of resources. We have a lot of capability to ensure pets, people with special needs have that continuity of care. They have a shelter that they can go to, but we can't help those that we don't know about. And so it's really important that if you have family members or your immediate family needs assistance with small animals, large animals, people in your family with disabilities or other types of illnesses, that it's communicated so that the people who are helping with that evacuation effort can best assist you. And again, thinking about, other alternative means of communication,
Right.
Facebook, any kind of email if you have access, even through an internet cafe or something like that at a Starbucks where you can go in and get some quick Wi-Fi if it's up and running. There are other alternative ways besides just strictly the phone lines to reach out.
So I think that's all the time we have for today. So this podcast was really about disaster preparedness because on Friday, like we mentioned before, we had one of the most successful disaster days. It was unique in many ways. It had hundreds of students involved. What made this one so special?
Well, Disaster Day has really become a signature event for the Health Science Center, like you said, and it's starting to attract a lot of attention because of the utility, the quality of the interprofessional experience, the potential for the lessons learned. It's a skill set that can't be taught in classrooms. And so this year we were fortunate. We had members of the Texas State Guard who came in and helped train. We included members of the Corps of Cadets here at A&M to come in and help with some of the logistical movement of people. In addition, we also had even international visitors. We had 2 people coming in from Germany, one from the German federal government who was here to observe Disaster Day to see how we bring in multiple disciplines to train together in a mass casualty event. The idea is he and the German graduate student who were here would be able to then take that back to Germany and work together with universities there to begin to create something similar in that country. And I really feel like, based on their experience here, the leadership, particularly the student leadership of Disaster Day, may have the opportunity to go over there and almost serve as consultants with the students in Germany to help them begin to develop this concept further. So it's a concept that, it began here locally. It was an A&M idea of selfless service, and we're able to extend that, hopefully, in the future overseas.
And it goes without saying, this is the second year we've had Disaster Day at Disaster City, TEACS, which, for those of you who don't know, this is a great resource. It's probably one of only 4 or 5 big training areas in the United States. And please take some time to check out some of their videos and information. They have people come in from all over the world to train there. So we're very fortunate to be in a place that have this great resource.
Disaster Day was on such a major scale. Was there anybody else in addition to TEACS that stepped in to help make this such a success?
Well, again, starting off with TEACS, we wouldn't be able to have the quality of the experience that we are able to provide these students without having something as magnificent as Disaster Day or Disaster City for them to go and train in. But, it involves a lot of people and a lot of expense, and we wouldn't be able to do that without having sponsors like HEB, who has stepped up for the second year in a row to provide a significant contribution to help us provide this level of training.
Yeah, that's pretty incredible how the community is supporting this event to you.
Absolutely. Couldn't do it without it.
Absolutely.
Okay, guys, thank you for coming on the show. Angela, Martin, it's been a pleasure.
Thank you.
Thank you.
This has been Sounds Like Health.
Thank you for joining us on Texas A&M Health Talk, a production of the Texas A&M University Health Science Center. Visit us on the web at vitalrecord.tamhsc.edu, where you'll find answers to all of your health questions. Until next time, stay healthy.